here today to provide a brief, hopefully brief and hopefully educational tutorial to those of you that will be working with the VitalSim mannequin in Foundations Lab. This may be helpful for, first of all, beginning faculty who need a refresher, and for other instructors, etc., to be able to understand the capabilities of the mannequin and to try and do some troubleshooting, and certainly to be able to take care of the mannequin. So we're going to start. This mannequin is called Nurse Ann. She is a VitalSim mannequin, which means that she does have some simulation capabilities. And we're going to start at her head. We're going to just look at her whole body. She's about 5'2" or 3", and she probably weighs about 50-60 pounds. So she is a little bit heavy when you are moving her in bed, so just be cautious of that. Certainly getting her out of bed to the chair should require 2 students to do that. So if we look first of all at her head, we do have the capability to put some wigs on her. And I should preface this by saying that she can also be a he, but we'll discuss some of that later. Starting with her eyes, her eyelids do open, and you can actually instill eye drops into her eyes. Her ears, we do have the capability of putting ear drops into her ears. Her nose, we can actually put a nasogastric tube in her nose. Her mouth, we can perform mouth care. You can, if you so choose, have the students remove her dentures for brushing and then put them back in. If you want to have an idea of teaching students how to remove and insert dentures, that's perfectly okay to do on these mannequins. If we look, I'm going to just take off her Johnny. If we look at her, she has fully articulated, she can't really bend her elbows, and we're going to talk about that, okay? She can bend a little bit, but here with her legs, she certainly has good range of motion with the legs and with the feet. And you can see that she's held together with these sort of little bolts here. She has a number of pads in both her thighs and her upper arms, her deltoids, and she does have an area here. I just showed it open for a ventrogluteal injection. These areas also, we have the ability to put some moulage, different wounds or whatever, if you were doing wound care on the patient. So, first of all, be clear that her left arm is her IV arm and her right arm is the arm for her blood pressure and her pulse. If you're trying to teach the students where to feel the pulse, if you look, you're going to see that there's an indentation here. Do note that with mannequins, very often if you press too hard, you're going to obliterate the pulse. So sometimes you have to press in and then very gently ease up until you feel it. So she does have a radial pulse. She has a generated carotid pulse. And by that, I mean she has this sort of bulb apparatus here. And if you squeeze this, you can feel her pulse. You can probably see my fingers jumping with that as I squeeze. Okay, so if you wanted to demonstrate to the students what a carotid pulse feels like, that's how you would do it on this mannequin. She does have a plug here for, we could remove this and actually put in a tracheostomy tube if so desired. If you look, you can see that she does have some posts here for EKG. So if you did want to hitch her up to an EKG, you do have the ability for that on those electrode posts. You can see her chest skin. Now, to take off her chest skin, she has these buttons on the back. You just pull the skin over the buttons like so, and there's some Velcro on the sides. And just go ahead and loosen that Velcro and remove the chest skin. She does have, because today she is a female today, and she does have breast inserts. Now, unfortunately, if you do have her as a male, she still will have, even if you take out the breast inserts, she's still going to have what looks to be breasts. We don't really have male chest skins for her. Underneath, you see this chest plate here. And you're going to see a series of holes. These are actually speakers. And this is where you're going to hear the sounds, her heart sounds, her lung sounds, etc. We don't listen to her lung sounds posteriorly, only anteriorly, because this is the placement of the microphones and the speakers. If we lift this off, you'll see a series of wires here. The only thing that you really need to know is that, in fact, the wires are connected. That's all, okay? If they are disconnected, they're very easy to connect again. They actually do just pull apart, but I don't have my glasses on to do that. So, and there's only one way to put them in. These are her lungs. And if I were to apply a mask with an ambu bag, you would actually see the lungs start to inflate a little bit. Over here, this is her reservoir, her stomach reservoir. So in the event that we did put a nasogastric tube down and we wanted to have something in her stomach, we could fill this with secretions and allow the students to evacuate and test some of those secretions. The only difficulty when you have secretions around electricity, as you know, or battery operated things, wires, is the issue of them getting wet. So if in fact we wanted to do that, if we wanted to have liquid in here, I would suggest wrapping the wires and maybe putting a barrier here so that the wires would not get wet should there be a leak. Okay, so I'm just going to put her chest plate back. Moving down, you're going to see her abdomen. And as you can see, she's just neutral genitalia today. She's got nothing because we can have either female or male genitalia, which I will go over. But to remove her abdomen, you just have to pull up on this abdominal wall here, and it will come out. Again, note the wire. So if in fact you are having students listen to bowel sounds, this is the abdomen that has to be in place. She does have different types of abdomens, like we have one that's got ostomies and whatnot in it. But if your purpose is to listen to bowel sounds, it must have this in place for you, okay? Also, if you want to, maybe Adonis, if you could take a good picture in there, you can see these screws, nuts and bolts. This is how her limbs stay in place. Okay, just in case one falls off, probably the screw nut is going to be a little bit loosened, and we just have to make that a little bit tighter. Okay. These mannequins are pretty durable. You can't do too much to really harm them. Along with this, she also has, as I said to you, these injection pads. And again, to take the injection pads out, just squeeze on it and pull, and it will come out. If you do use these for injections, the only thing I ask is that you let me know so that we can take the sponge out, clean it out so it doesn't get moldy. To reinsert, just like so. Okay. So that's the basic anterior portion of the mannequin. If we were to turn her over, you can see She does have these heavy-duty face plates here, etc. Her bottom. Again, she has a little ventrogluteal pad here for injections if you wanted to give her an injection. And you do see these, they're actually veins, these rubber tubes. So this is her IV arm. In the event that we want to have IV fluid running into her, and we can do that, we would start an IV and one of the tubes would be clamped off and one would actually be hitched up to a collection bag. The collection bag just allows the fluid that you're running in to collect. So we usually hide that somewhere underneath the pillow or whatever when we're running a simulation. Okay, so that's the basic mannequin. But in order to make her operational, there is another portion, and that is the VitalSim box. So the other parts to this mannequin is this VitalSim box and the VitalSim controller, okay? And it's very easy to hitch up, very, very easy. Along with that, the patient has her own blood pressure cuff because it's got to be hitched up to the program, actually, in order to have the students hear the blood pressure that you have set on the mannequin. And I would encourage you to try it yourself first so that you feel comfortable with the settings that you've put it at. So if you look at what the mannequin has, she's got these two wires here, okay? So if we take the VitalSim box, and you can see, it just hitches together like so. Pause. So it just, can I go? Yeah. So it just hitches together like so. Just presses in together. Oops, I need my glasses on again to do that, sorry. Okay, and then these little gizmos just screw into place here on the ends. You have a little piece here, and that gets hitched up to this. So the way it works is it just goes in. You see how that's working? Goes in like that and clicks in place. To set this up, in the event it wasn't set up, all you have to do is go ahead and plug the male end into the female end. It's very easy. And then just turn these pieces until you feel a tightness. You're going to see that there's a little clear plastic and another clear plastic. They're both hitched onto this big wire here, okay? So those also have to be connected together. Again, there's only one way to connect them. So you put it in and just twist to lock it in place. You're going to see that there's one more wire clear tubing connector. And that actually hitches up to the blood pressure cuff. Okay, again, push in and twist in. So, we turn the unit on by pressing the green button. Once you turn the unit on, you should see this green light will begin to blink, okay? That means that you actually do have, juice going to the mannequin. But in order to make the mannequin work, we must also turn on the controller. So the on button is down here. Once these two are connected, you're going to see that green light will actually turn solid. And that helps you to know that everything that you've programmed, and I'm going to show you the programming piece that you've programmed, is now operational with the mannequin. So if you look at the menu, you're going to see heart rate on the left side, lung sounds, bowel sounds, heart sounds, and vocal sounds on the right-hand side. In order to change the parameters, if you whatever's highlighted is what you're working on. So right now it says that we are sinus of 80. I'm going to press OK, and that's going to tell me I'm in a sinus rhythm, but it's going to give me whole lots of other options if I wanted to maybe do some PVCs or an AFib or tachycardia. But it also gives me the option to change that rate by pressing this button, which you can see a plus sign over it, and that would make it 90 or 100. On the heart rate, it only goes up by tens, okay? So 100, 110, 20, 40, etc. Okay. Let's come over to lungs. In order to switch to the right field, you want to use your right toggle switch, and that will highlight lungs, and it says they're normal. If I press OK, I can actually scroll down and give my patient some crackles. If I'm teaching students lung sounds, I might want to change it up a little bit. I can do the same for heart sounds, bowel sounds. For bowel sounds, the only menu you have is hyperactive, hypoactive, borborygmus, etc. Okay? And you also have the ability to change the volume, so do look at that as well. This patient has very limited vocals, but she can cough, she can moan, she can vomit. She can say yes, no, and a few other very simple things. So I would tell you that in order to feel comfortable with this, you just have to come in and sort of play with it, all right? To set a blood pressure on the mannequin, there are 2 steps actually. First, you have to go to menu, and the menu button is right here, okay? And you're going to scroll down till it says calibrate blood pressure. And it will say inflate cuff to 100, then press the calibrate button. The calibrate button is right here. It says calibrate right over that button. So what I want to do is I want to come over to my mannequin, and I want to inflate the cuff to 100. Once it gets to 100, I'm going to press calibrate. You're going to hear a sound. It sounds like rip, rip, something like that. And you're going to see right here, it's going to tell you that this patient was calibrated at 100 milligrams of mercury. Millimeters of mercury, sorry. Then we get out of that screen. Just press OK. It'll bring you back to the regular screen. We want to come down and go to the blood pressure, which is on the very bottom. Right here it says it's 120/80. We want to change that up. So if I press OK again, it will bring me to an area where I can increase or decrease the blood pressure. Now with the mannequins, and this is what I want to stress, do listen to it yourself first, okay? Make sure you're hearing the blood pressure right. I would give it like probably 2 to 4 points difference with both the systolic and diastolic. If you're not hearing it well, come to the volume and turn the volume up. Volume can go all the way to 9, okay? It's usually preset at 5, but do know that you can get to, you might want to increase it to 9, especially when students are just starting to hear. We do have the double stethoscopes so that, you know, if you're listening with a student, you can say, okay, I'm going to put my hand down when I hear that first beat and listen, see what you hear. Because sometimes it's really hard for them to be looking at the dial and listening, etc., all at the same time. Okay, so that's about it for the mannequin. We're going to review some of the different overlays, etc., that the mannequin has, and hopefully that will help you in your teaching. So for your lesson today, say for instance you wanted to talk about ostomy care with your patients, with your students. You would want to take out this abdomen, okay, because this is the abdomen where we're listening to bowel sounds, and we would want to put in this abdomen. Okay, you can see she has a number of plugs here. So we could actually put in a stoma if you wanted to illustrate care of the ostomy, etc. You could put a stoma in there. We can also fill up this abdomen. There is a reservoir in there. If you wanted to be able to, say you said that it was a suprapubic tube, and you wanted to have the student actually go in and catheterize that suprapubic stoma. So just ideas. Again, the mannequin can be male or female. So you would just take out and replace the genitalia. So male genitalia and female genitalia, okay? And it just plugs in there. You'll see that there are these little connectors. Again, if you wanted to allow urine to come out, we could set something up so that urine can come through. I would say with these older mannequins, I do understand that the newer one that we just got, it works well on, but the older mannequins, it's usually more hassle than it's worth. So I would just maybe just consider simulating or talking about being more focused, I guess, on the procedure of catheterization rather than what comes out. So as I said to you, we have a number of different ad pieces that we could put in our mannequins. Okay, so this is like a bad burn that we could put in for wound care. On the older mannequins, such as these, the wounds, the surgical wounds, etc., are overlays. So they're not fantastic. They're okay, but not fantastic. But it allows the student to be able to do wound care, irrigation of wounds, dressings, etc., etc. I'm going to take you over to the table and just show you a couple of the things that we have in the event you wanted to use those on your patients for learning experiences with the students. So over here you can see we have some moulage. This is a surgical wound with suture with a Penrose drain. This is a surgical wound with staple, Penrose drain. Again, overlay. So it just sort of lays on top of the abdomen of the patient. Not ideal because when we're cleaning, sometimes it shifts. We do have an evisceration. We also have just an overlay with just a painted on suture line, okay? But you can't really feel the suture like you can on the other. If you wanted to do a simulation on a patient who had a tibial fracture, and you can feel it actually displaced, and you can see this big hematoma down here on the lateral aspect of the foot, we could attach this for that learning experience. We could attach a foot that has an amputated toe for learning experience. We could attach a residual limb for patients showing a below-the-knee amputation. And right here, this is supposed to be the suture line or the closed area. You can feel the ridges. Just another leg. And here's an open abdominal wound, okay? So we could use that sort of wound for showing packing of a wound. So I hope that this was helpful. I hope it gives you a bit of an orientation to the mannequin. Again, a lot of it is, coming in and practicing with that toggle switch, understanding them. When you see this blinking light, what has to happen is you have to then press the handheld portion on again. And that, again, reconnects the mannequin. It times out fairly quickly. So after about 10 minutes, you do need to press that button again. So just paying attention. If these are not speaking to each other and the student's taking a blood pressure, they're not going to be able to hear the blood pressure, and that's the reason why. So again, I hope it was helpful. Let me know if there's anything I can do to make it easier for you. Thank you.